Good afternoon from Bangkok, Thailand. Welcome to the Tropical Medicine Cluster Chulalongkorn University Symposium on Dengue in the midst of COVID-19 pandemic. This is in commemorating 2021 ASEAN Dengue Day and Advocacy for World Dengue Day cross-sector Synergies forums. Ladies and gentlemen, it took several decades before dengue became global problems, but it takes only a few months for COVID-19 to went all over the world and became a big problem. But you can listen to several experts here, because both viruses have potential antigenic cross-reactivity. So you can listen to them, what's going on between these two viruses. And I think that we have 5 eminent speakers today. And the first speaker, actually I should introduce myself first. My name is Thisyakorn. I'm the Executive Director of Tropical Medicine Cluster, Chulalongkorn University. And the first speaker is Professor Terapong Tantawichien, who is the Chairman of the Tropical Medicine Cluster, Chulalongkorn University, Bangkok, Thailand, and the Chairman of Department of Medicine, Faculty of Medicine, Chulalongkorn University as well. And he is also Assistant Director of Queen Sawapa Memorial Institute, Thai Red Cross Society. Today, he will present on the overview of dengue in the midst of COVID-19 pandemic. Professor Terapong, please.
Thank you, ADVA and Professor Thisyakorn, Executive Director of the Tropical Medicine Cluster, Chulalongkorn University. I'd like to share my slide. So my topic is a dengue in the COVID-19 pandemic. This is my disclosure. I work in the many vaccine in the research and also the lectureship in many companies and also public health Thailand. So we know that the dengue is our problem for a long time in the endemic area in Thailand or in Asia, Southeast Asia, and also in South America. And we have the increasing of the COVID-19 cases in the world now. Sorry, I will open this one. Sorry. So now when you see this graph, okay, you can see that the COVID-19 increasing in South Asia and East Asia now when compared with in the European country or in the America. So now we have the problem, and you know that in the next this year or the next few months we will have the problem with the dengue in rainy season. So in the area that we have the dengue in our practice, we may have the two problems at the same time. For the dengue in the COVID pandemic, we have to concern about 3 things. The first thing, significant co-circulation between both disease, and it may be affect to the health system or healthcare system in the endemic area. The second thing, we have to think about how can distinguish the COVID-19 infection and the dengue infection. Is a problem in the practice and the problem in the medical care in this area. And also impact of the lockdown and social distancing on the dengue in the area. So I think that many authority in that work in the dengue endemic area, they know about this thing. They're concerned about this thing. They said that it may cause the double trouble in the European country and in the serious health concern, and also in Brazil and also in Asia. We know about this thing that we will have the 2 problems in the same time, in the same area, and we care about the medical care in our practice. So when you see the OLAP epidemic that report in Colombia, the first sample, you can see that 2020, when compared with 2019, the case decreasing, lower than in the 2019. But when you see the dengue infection, it looks stable when compared with the COVID-19 infection. But when you see in some area, some may have the increasing of the dengue infection, some may have the decreasing of the dengue infection. So it means the very important about the 2 diseases in one area, what happened, especially when you have the season of the dengue and we have the spreading of the COVID-19 at the same time. So for the first thing, we have to care about the healthcare system. The second thing, we have to think about how can differentiate COVID-19 infection and the dengue infection. Why we have to differentiate? Because it may problem in the morbid mortality, it may misdiagnosis to the other disease and maybe wrong management and maybe spreading of the COVID-19 occur in the hospital. And also if you have the co-infection in the same time, in the one person, it may cause a serious illness or not. The study that the preprint in critical infectious disease maybe in the next few months, okay, that report from Brazil is a population-based cohort. They found that if COVID-19 infect in the patient who ever had the dengue infection in the past, it may be more clinical apparent of the COVID-19 infection. That is very important. If we have the COVID-19 infection spreading in our area, we may have more case, need hospitalization, needs to medical care. That is maybe overload in the medical system. However, the other report in ACTA Tropica 2021, okay, you can see that in this publication, then they did not found the increasing of the severity or increasing of the hospitalization if COVID-19 infection in the people who ever have dengue infection. But if you have the co-infection, but I think it's uncommon. If you have the co-infection between COVID-19 and dengue, it's increasing of the pneumonia and increasing of the hospitalization. That is mean that both disease in the same area, it may cause problem. And many studies try to differentiate between the dengue and the COVID-19, but it's not easy because they will come with the viral prodrome. But someone said that in the dengue, they may have more retroorbital pain, they may have the purpura, they may have the abdominal pain or person vomiting. But I think that in my mind, it may be, it's not easy to differentiate or to distinguish the both disease. Examples, one study showed that if the patient come with the flu-like illness or febrile illness and they have the history of the contact COVID-19 or they have the anosmia, it's very likely to the COVID-19 infection in this person. However, when you see the example in Singapore, you know that in the area that we have the COVID-19 spreading, we have to aware of the patient. The person may come with the COVID-19 infection, as it may cause the spreading of the infection and maybe have the severe illness. So in the routine COVID-19 testing for by patient with viral syndrome, in this study, they found that around 8% of suspected COVID cases were tested for dengue serology. Does it mean that in the clinical practice, they have to think about the dengue in the patient come with suspected COVID-19, and they sent out 8% to test the dengue, and they found out 2% the patient have the dengue, and however they found some case it false positive dengue in COVID-19 infection. So it's very important that we know that now by the rapid test of the dengue or ELISA is maybe cross-react with the COVID-19 test, so it may be misdiagnosed the COVID-19 infected patient to dengue patient. What happened? Example in Thailand, we ever have like this case. The patient come with the COVID-19 infection, but diagnosis was the dengue. So it spread to the nurse in the hospital, and the nurse had the pneumonia. So someone said that in the dengue endemic area, we have to use the NS1 or PCR to test dengue to make sure that the people have the dengue. But I think it's expensive and we cannot use it in some hospital in rural area. So the problem to diagnose of the dengue. For co-infection, in my mind, I think it's uncommon. We don't know co-infection may cause the serious illness or not, but the data in ACTA Tropica show that it may be more pneumonia and more hospitalization in the patient who have the co-infection. So finally, I'm concerned about this thing because many countries, they have the dengue in adult and elderly. And we know medical comorbidity increase hospitalization and mortality in the adults and elderly who have the dengue. But also medical comorbidity, it also cause the severity, cause the high severity in COVID-19 infection. So if they have the both disease in the area, they may have the many more patient hospitalization and maybe higher mortality in the area. So the last thing about the impact of the lockdown, we know we use the lockdown process to control the COVID-19, such as the travel restriction, such as the workplace control, close school, close university, close manufacturer, and also use the physical distancing. This process, it may affect to the many infectious disease, such as in Thailand, in Korea, you can see that decreasing of the influenza last year occurred in Thailand because we distancing, it may be decreasing transmission between influenza in our community. However, the effect of the lockdown of physical distancing on the dengue, some countries said that lockdown will decreasing of the dengue infection in this area. Some countries said that it increasing infection of the dengue in the area that they have the lockdown process. So it may be different country, different area. Why? Because it depends on seasonal period. If you lock down occur in the rainy season, you may not have the effect of the decreasing of the dengue. It may be depend on previous outbreak or short period lockdown. It may not affect to the dengue. And you know that people spend more time at home. It may be get benefit that they may clean their home to get rid of the vector or some storage in their home for the vector. But it may be increase the contact with the mosquito. Okay, reduce the household movement is maybe reduce transmission. And also, you know that surveillance system is maybe disruption, such as no report because everyone stay at home, so they have the not work about the routine surveillance system. And disrupt of the routine vector control program that can occur. No one go to your home to destroy the vector or something that. Different age group, such as if you have the transmission occur in children and school course, you may reduce the transmission. And finally, travel restriction is maybe important. You may reduce the dengue in traveler. You can see that in Sri Lanka. Sri Lanka, they have the lockdown and incidence of the dengue decreasing. But in Malaysia, that in the literature, they said that in the first lockdown, dengue decreasing. But in the second lockdown, dengue slightly increasing. It may caused by the vector exchange to the AD albopictus. And finally, in India, they found that in the lockdown area, AD immature density has dramatically increased in both local areas due to temporary discontinuity of the AD surveillance. So the lockdown may have the effect, but benefit or harm is depend on the area. So you can see that in Taiwan had the dengue infection in the southern part. And you see that the decreasing of the locally transmitted dengue case, but very dramatic decreasing of the import dengue case occur in Taiwan. So I like to say that in the lockdown, we need to be done avoid adverse effect of the lockdown. We have to continue maintain and strengthen acid dengue control practice. We have to use everything like the same that we ever used in the many years ago. So finally, I think that dengue in the COVID-19 pandemic, it may cause some problem in dengue endemic area in South America, in South Asia, or maybe Southeast Asia. And we concerned about in the practice to diagnose and differentiate between these disease. And the lockdown is maybe get benefit if we still maintain and maintain the vector control program like we use it for a long time. And thank you very much.